Hi, Dr. James here again from Integrated Physicians Medical Group. So I want to talk to you today about many of the procedures that you may have undergone and why they may or may not have worked. And we're going to be brief about this, but hopefully thorough enough for you to understand. So a lot of patients come to us and they've had physical therapy, or they've had epidurals, or they've had facet injections, or they've had chiropractic care, and they've done a lot of things and they've seen a lot of very good practitioners, and they just didn't get the result. Or the result that they got, maybe it was temporary, maybe it was a day, maybe it was a week, and maybe you're experiencing that very thing, that you're running out of ideas because you've been to all these different doctors who've done many different therapies that seem to work, but they didn't really have any long-lasting effect. So we're back to the diagnosis aspect of this, and that is diagnosing what parts of the spine, what parts of your health have been failing that would be contributing to you not healing properly. So what we find often is that what's happened is that you've had different treatments in isolation. Sometimes when we combine all of those treatments, we get a stupendous result. Let's give you an example. So for instance, somebody has a disc problem, but also has facet arthropathy that's causing them their pain. Well, sometimes what we need to do is decompress the spine from the front, but do maybe some injections in the back, facet block injections in the back. Now, a lot of patients have said, well, I've had facet injections and they haven't worked. We use them to give us a therapeutic window to restore function to the front of the spine that actually takes the pressure off of those facet joints. So if you're just going to inject the facet joint in and of itself, sometimes that can give just temporary relief because it's reducing the inflammation to the joint, but it's not reducing the reason why the body's even shifted its weight onto that joint and why that joint is inflamed. Does that make sense? So we may need to do that. We may need to do some particular brain-based activities to start to fire up the muscles in your spine to give them more stability. And then we have to give you some very specific exercises to work on those anti-gravity muscles so that you can resist gravity the way that you were designed to. All that in the context of, depending upon how much degeneration has occurred in your spine, how much physiological damage has occurred, will really determine what the probable predictable future is for you, what your outcome would be with that. So we take all of those things into consideration, but the important thing to know is, just because you've had many different therapies, and we may even require or ask or suggest that you do some of the therapies you had before, but it's the sequencing of how we do them that makes all the difference in the world. You combine that with looking at you metabolically and maybe looking at certain dietary aspects that may be changing it, and you may be very, very surprised and very delighted to get a result that you weren't able to get before because somebody finally understood the totality of your body, how all these systems integrate, and when you address all the different tissues that are malfunctioning, that's when you stick the key in the lock and the door opens up for you to a better life.